My name is Mark Sneddon, and I'm the Operations Manager for Sync. Today we're going to be covering how to create an electronic request for medical records and have it delivered to your healthcare organization. Let's go ahead and get started. I'm going to open up the SyncMD app, and I'm going to click on the little blue plus sign in the bottom right corner. This will bring up the Add Documents menu, which provides a list of options for adding new documents to the SyncMD app. In this case, we need to request from our healthcare organization. If your healthcare organization is SyncMD release ready, then you can search for it by name and the results will be displayed on the screen. You can see here. If your organization is not SyncMD release ready, then you will need to find the medical records fax number of the organization. We provide some instructions to the user on how to do this, but in general, you'll want to call their front office and ask for the fax number of that department. For our purposes, I'm just going to enter in a fake fax number and say that this is going to Dr. Smith. Next, the SyncMD app will walk you through a guided process in which you will create your request. We'll ask for the types of documents that you're requesting, whether it's the pertinent record set, specific records, or all of your records. I'm going to select the pertinent record set as that contains a summary of all my health information. Next, I need to specify the dates of service that my documents belong to. This is important because my healthcare organization will only return documents that are within that date range. I can specify by a specific date, such as the last month, last year, or an actual date. I can say I want documents between certain dates, or I can say I want all documents from before a certain date. In our case, let's say that we just need my pertinent record set since the last visit. Next, if you haven't already, the app will ask you to attach a picture of your driver's license, which the app will scan automatically, as well as provide an electronic signature. This is done for identity verification purposes by the receiving entity. By having a copy of your driver's license included with the form, they can perform their own independent audit to make sure that your personal information matches their own record. Next, you'll provide some demographic information as a secondary verification point. And finally, you will be able to view, verify, and approve the form that has been created. As you can see, you can fully zoom in and out. The text is hard to read, and you'll be able to see exactly the information about what your request includes. In this case, I'm requesting from Dr. Smith my pertinent record set since my last visit. There will also be a small convenience fee charged for your request. In this case, the fee is $6.50. However, that full amount will be refunded after 30 days, as that is the time limit that HIPAA gives healthcare organizations to reply with your records. If they take any longer, they're in violation. So obviously we do not need to charge anyone in that scenario. So once you have confirmed and agreed to the charge, you're going to check that you have agreed with the form, proceed, and then submit your payment. In this case, our request is processing, and we will pay with Apple Pay. We'll double click, confirm with Face ID, and the payment will now process. As you can see, the payment is finished processing. I have a receipt that has been sent to my email, and I can now see the completed request form saved into my SyncMD account. I can see my payment history for actual request form, as well as any activity that has gone on with my request. Receiving entity will then receive my request along with all the information they need in order to upload my documents to my SyncMD account. When they do so, I will receive a text message notification letting me know that I have new documents available. Thank you for watching and have a great day.